like to introduce our chiropractor, Dr. Dr. Joubert Desulme, who's been a chiropractor for 12 years. He's the man of the hour, man of power, a man too sweet to be sour. Let's give a warm welcome for Dr.
That's the position ever. Thank you so much. Everyone. Now, with this presentation, I have 10 minutes, right?
8.
I can 8 minutes, right? See, I can talk all day, so I'll try to go fast. So, recently I attended a seminar about a Parker seminar, and there was a gentleman under the name of David Sinclair. Dr. David Sinclair, he's actually a biologist for Harvard. And guess what they're working on how to stay younger. And what can they do to stay younger? As a matter of fact, there's a medication that they're working on to allow you to actually 10 years of your age. Now, through the whole presentation, there's one thing I noticed that he did not mention. He did not mention how you can get a new spine. Well, yes, you can stay younger, but that spine is not going to get any younger. So guess how long it will take before that medication come out? Quick guess.
10 years.
10 years? Nope, 2 years. Within 2 years, they're working on the drugs that will actually make you 10 years of your life. And they're actually working on curing glaucoma. They're working on curing macular degeneration. So that's what they're working on. So why did I bring that to your attention? It's because the aspect of living younger is very prominent. Now, in the back picture, this is my family. This is my wife, Kai. We've been together for about 23 years. My oldest daughter, Anna. My middle one, Isabel, handful. And my youngest one is Jonathan. And every now and then we travel. We try to travel every year to go different places. That's it about that. All right. So why do we need to live younger? And what happened is that by 1900, most people were dying at the age of 49. Now the average lifespan is about 80. So if you think you're going to live up to the age of 80 and you're not doing anything about it, the likeliness of you having some problem down the road is very highly. Most of us play sports. We can end up have sports injury, but we're so young, we're so infallible, we don't really think about it that much. And this is why a lot of time we are hurting. And then now, because we are living longer, and one of the things that they are noticing is happening is that we start noticing more common about people having Alzheimer's, Parkinson. Those are become more common. Is because we didn't think, most people didn't leave that old age to actually get to that stage. This is why they start working on this medication to actually try to see what we can do to make the person younger. Am I going backward with this thing? Yeah. Sorry.
It's a little bit backwards.
All right, so now the average life, now if you're going to live to the age of 80, and right now at the age of 50 you start having lower back pain or you start having some sort of pain, right? And you don't do anything about it. That's 30 years without doing anything. That's 30 years of your life miserable. This is why I'm getting called from patients that they can't move out, they can't get out of bed, they cannot move. Part of the reason being is because of the injury, because they ignore it. The gentleman that I mentioned earlier is not something that just happened. He's only 33 years old. It's something that's been there. We ignore it over time. Now it no longer can be ignored. That's where the injury started happening. I did it again, didn't I? All right, so now this is what we used to have. Our teeth used to be decay in front of our eyes, or our teeth used to die before us. Now we prevent, we do anything to prevent it, right? Same thing with cosmetic surgery. It has increased by 465%. That's the desire to stay young. So the problem is that with staying young, yes, how you stay young, but you can barely walk, right? Because of injury. So those are the things that you have to look at, is that you have to take care of your spine, because your spine is the most important thing in your body, because without your spine, you cannot move, right? But the reason why we don't take care of it is because it's not nobody can see it. If out of sight, out of mind, you know that term? So that's what happened when we're not taking care of ourselves. All right, now look at this spine. This is a spine. This is actually one of my patients that come in with with a slight injury. It wasn't much injury, but look at the spine compared to the other side. Right? Now, do you think I'm going to go ahead and adjust a patient like this? No, because what you're looking at ritualostesis, severe degeneration, most likely multiple herniated discs. So in a case like that, what I'll use is what they call an activator. The activator is less tension. It can actually adjust the patient without putting too much pressure. So I'm telling you, it's going to go pass around to, or you just click that button, and then you will go. So that way you're not putting too much pressure on the patient, because I get that call a lot. It's like, well, how long, I don't like to be adjusted, which is fine. My treatment, I've learned 9 different techniques. My treatment based on how the patient responds. It's not how I feel, right? So my goal is to get my patient better, whatever it takes to get you better. And those techniques, if you don't want to get adjusted by hand, I use the activator, and I use another technique called BESS, where I'm not even putting too much pressure on you at all. So that's why when patients say, well, how do you adjust an older patient? Well, that's what I use. I use activator. If you have osteoporosis, I use activator to adjust you. So that way we're not putting too much pressure on that patient. All right, so I was informed that I have 2 minutes. So now you have one out of 3 people going to have some sort of neck pain in their life. And then you have 85 out of 100 going to suffer with lower back pain. If that's that prominent, then why are we not doing anything to prevent it? Why are people not doing anything to prevent it? It's because they don't see it, they can't deal with it. If it's not hurting, it's not preventing us from going to work, we're okay. But down the road, we end up paying for it. What we're not realizing actually, I'm gonna fast forward a little bit. What we're not realizing is that it's not just the spine causing the problem. A pain that we receive is 5% of signal that you receive. Majority of the thing you receive is stimulation. That stimulation that goes to your organs, your heart, your lung. Every nerve that's come from the body goes to the organs. If there's an interference where it's not moving properly, this is when we start having problems. Yes, we a lot of time we focus on the symptoms, but not the cause. In the meantime, you will never see a spine fully healthy with having discomfort. I've yet to see that. If somebody can show me a perfect spine, but they're having all kinds of symptoms, then I'll give you $100. That's a bet, okay? Because it's not going to happen. It's because a lot of time we focus on the symptoms, not the cause. And what I want you guys to start thinking about, what is the cause of my problem? When we focus on the cause, that's when we get resolved. All right, this is a patient that came in with frozen shoulder after 2 treatments. Many people ask me, well, do you only focus on the spine? No, I actually work on patients with frozen shoulder as well. And this is a young patient with torticollis. As you can see the picture from left to right. And this is a young patient coming with colics. That patient is about a week old. So, and last but not least, and here's the referral for me. So veterans, if you know any veteran that veterans need it the most because they suffer a lot, they don't know who to go to. Personal injury, I work with Mary, I work with all their attorneys as well. So if you know somebody suffering from neck pain, lower back pain, numbness, or any sort of discomfort, have them give me a call. I work with golfers to improve their swing, to prevent them from injury. I will also work with a booking organizer. I do corporate wellness for company that want wellness in their practice to save them on medical bill. So if you know someone that is suffering, friends don't let friends suffer, right? So have them give me a call, Dr. J here.